coronavirus. So, what is coronavirus? Coronavirus that originated in Wuhan, China, has killed at least 360 people and infected more than 17,000 people in China. Coronavirus are zoonotic diseases, meaning they jump from animals to humans. Both this virus and SARS originated in bats when they jumped to people, according to two new studies. The Wuhan coronavirus shares 80% of its genome with the coronavirus responsible for the SARS outbreak. The study shows, according to experts, pre-trial vaccine aimed at treating SARS could be effective against the new coronavirus. So we are done talking about the origin of the coronavirus, and for now, I'm going to share or to illustrate how to prevent that virus. Clean hands with using the soap. Before and after eating, we need to wash our hands to keep it clean. So this is the proper way of washing your hands. I am now using the Bioderm soap. Massage your hands gently and scrub it. Clean the gaps of your fingers and also the tip. And you need to wash it. You need to wash it at least 20 minutes. So after washing your hands, even if the dirt is not visible, you should still apply alcohol to eliminate the virus. So now I am using the green cross. I will apply it to my two hands. We need to apply the alcohol to eliminate the virus. So that's it. After applying the alcohol, the third one is avoid close contact with anyone with cold flu-like symptoms. This is what you should do. So, we need to distance ourselves to person who is sick and avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash can. So next, thoroughly cook the meat and eggs. So when we are cooking the meat or an eggs, so we should cook it properly so that the bacteria will be eliminated. So the last one is avoid unprotected contact with live, wild, or farm animals. We should avoid from wild animals. For example, the rats, dog, and the cat. They can infect a person.
New coronavirus is spreading fast in China. So far, cases have been confirmed in more than 13 countries including France, Germany, Australia, and the United States. The fact that this virus has caused severe illness and sustained person-to-person spread, this is a serious public health threat. Human coronaviruses can cause lower respiratory tract illness such as pneumonia or bronchitis. For confirmed and coronavirus infections, reported illnesses have ranged from infected people with little to no symptoms to people being severely ill and dying. Symptoms can include feeling tired, difficulty in breathing, a high temperature, a cough and sore throat. These symptoms are similar to other respiratory diseases including flu and the common cold. So, if anyone has symptoms, consider the following. Have you traveled in the last 2 weeks to a high-risk area? Have you been in contact with someone who has? CDC believes at this time that symptoms of novel coronavirus may appear in as few as 2 days or as long as 14 after exposure. This is based on what has been seen previously as the incubation period of MERS viruses. There is also some evidence, as yet unconfirmed, that the virus can be spread by asymptomatic people, that is, people who carry the virus but are not yet sick. If this is correct, it will make the viruses considerably more difficult to control. The risk of individuals is dependent on exposure. At this time, some people will have an increased risk of infection, for example, healthcare workers caring for novel coronavirus patients and other close contact. Hand hygiene is the first and most important line of defense. Like cold and flu bugs, the new virus is spread by droplets when a person coughs or sneezes. The droplets land on surface and are picked up on the hands of others and spread further. People catch the virus when they touch their infected hands to their mouth, nose, or eyes. It follows that a single most important thing you can do to protect yourself is to keep your hands clean by washing them frequently with soap and water or a hand sanitizing gel. Also try to avoid touching your mouth, nose, or eyes with unwashed hands. Other tips include carry a hand sanitizer with you to make frequent cleaning of hands easy. Always wash your hands before you eat. Be especially careful in busy airports and other public transport system about touching things and then touching your face. Carry disposable tissue with you. Cover your nose and mouth when you cough or sneeze and dispose to the tissue carefully. Do not share snacks from packets or bowls that others are dipping their fingers into. Avoid shaking hands if you suspect viruses are circulating. Regularly clean not just your hands but commonly used surfaces and devices you touch or handle. There is no simple cure for the new coronavirus, just as there is no cure for the common cold. In more severe cases, the virus causes pneumonia, an infection that inflames the lungs and causes breathing difficulty. This is where the main danger lies. Viral pneumonia cannot be treated with antibiotics, and for the moment at least there are no antiviral drugs for this particular virus. Instead, doctors focus on supporting patients' lung function as best they can. They may be given oxygen or placed on a breathing machine in the most severe cases. So, prevention is better than cure. Take care, stay blessed.
How to protect yourself from coronavirus. On December 31st, 2019, World Health Organization was alerted to several cases of pneumonia in Wuhan City, Hubei province of China. The virus did not match any other known virus. This raised concern because when a virus is new, we do not know how it affects people. 1 week later, on 7th of January, Chinese authorities confirmed that they had identified a new virus. The new virus is a coronavirus, which is a family of viruses that includes the common cold and viruses such as SARS and MERS. This new virus was temporarily named 2019 novel coronavirus. Coronaviruses are important human and animal pathogens. Symptoms include fever, coughing, and shortness of breath. Unfortunately, there is no vaccine available. There is no specific treatment or cure for the virus. Patients are given supportive care for their symptoms. How do you reduce your risk of coronavirus infection? World Health Organization recommends the following. Regularly clean hands with soap and water or alcohol-based hand rub. Cover nose and mouth when coughing and sneezing with tissue, sleeve, or flexed elbow. Throw tissue into a closed bin after use. Clean hands after coughing or sneezing. Wear a mask. Masks should not be touched or handled during use. If the mask gets wet or dirty with secretions, it must be changed immediately. Discard the mask after use and perform hand hygiene after removal of the mask. Avoid close contact with anyone with cold or flu-like symptoms. Some patients may already be harboring the virus and still have no symptoms. Thoroughly cook meat and eggs. Avoid unprotected contact with live, wild, or farm animals. Avoid contact with stray animals, waste, and fluids when shopping in a wet market. Wash hands regularly after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, and after handling animals or animal waste.